Hi everybody. In the last several videos we've been talking about Dr. Bredesen's RECODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2016, 2018, 2022, and current clinical trials. Today we're continuing on with the Cognoscopy, Dr. Bredesen's diagnostic framework for screening all potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the very important lab marker, fasting insulin. Next up, we're coming over to total cholesterol. So what is cholesterol? Well, what kind of question is that? Who hasn't heard of cholesterol? We've all heard how we should keep our cholesterol levels down as part of a heart-healthy lifestyle, how keeping our cholesterol levels low prevents heart attacks and strokes. But what is cholesterol really? Cholesterol is an essential lipid, a fatty substance our bodies need for building cell membranes, making hormones and vitamin D. It also plays a crucial role in brain development, function, and overall health. It is a vital component of cell membranes, influencing neuronal structure, signaling, neurotransmission, and it's essential for myelin and synapse formation. Remember, myelin is that fatty sheath around neurons and nerve cells that allows electrical impulses to transmit quickly and efficiently between each other. And synapses are the connections between neurons that allow for communication with other neurons and muscle cells. If cholesterol is so essential in these brain and bodily functions, then why has it gotten such a bad rap for so long? Well, the Framingham Heart Study, a long-term observational epidemiological study that began in 1948 in Framingham, Massachusetts, established a strong correlation between elevated cholesterol levels and increased risk of heart disease. In 1957, it published that higher cholesterol levels were proportionally linked to increased risk of coronary artery disease, and by 1961, it identified high blood cholesterol as a key risk factor for cardiovascular disease, along with other factors like elevated blood pressure, smoking, lack of exercise, and obesity. This laid the groundwork for the lipid hypothesis, which underpinned cholesterol-lowering statin drugs being introduced into standard of care, as well as low cholesterol dietary guidelines. What wasn't taken into account in the lipid hypothesis was someone's insulin resistance lab markers and status in conjunction with elevated cholesterol levels. We'll come back to this. There are several labs that give us a good picture of where we're at with cholesterol, but let's start with total cholesterol. So what is total cholesterol? Total cholesterol is a blood test measuring the sum of HDL cholesterol, also known as the good cholesterol, LDL cholesterol, also known as the bad cholesterol, and 20% of triglycerides in the blood. It's typically taken after a fasting period of at least 9 to 12 hours. According to standard of care, the normal range for total cholesterol levels is generally considered to be less than 200 milligrams per deciliter. But American Heart Association recommends total cholesterol of less than 150 milligrams per deciliter for those with high risk, especially those with a family history of heart disease or genetics that predispose, like the ApoE4 gene, or for those who are just trying to be optimal. When broken down, this guideline advises that HDL be at or above 60 milligrams per deciliter, LDL be at or below 100 milligrams per deciliter, and triglycerides be below 150 milligrams per deciliter. But Dr. Bredesen and his team have seen optimal cognitive health and function with total cholesterol levels above 150 milligrams per deciliter, not less than. They've seen in their patient populations brain atrophy and shrinkage, as well as hormonal imbalances and insufficiency when total cholesterol levels fall below 150. He's also found that many people with high cholesterol have no problem with vascular disease, and many people with normal or low cholesterol have significant vascular disease. And vascular disease itself raises the risk of Alzheimer's or vascular dementia. So what gives? Insulin resistance. It's insulin resistance that is the biggest risk factor in the development of vascular disease. So if we're walking around with elevated blood sugar and high insulin all the time, causing chronic inflammation to the linings of our arteries, and we have high cholesterol levels on top of that, we're going to have issues with our hearts and brains. Again, Dr. Bredesen's optimal total cholesterol blood lab levels are above 150 milligrams per deciliter, as cholesterol in the absence of insulin resistance is essentially important to our overall and brain health. How that breaks down is HDL be at or above 60 milligrams per deciliter, no real guideline for LDL, more on that later, and triglycerides be below 70 milligrams per deciliter, as opposed to the standard of care is 150. The big difference here are how LDL and triglycerides get treated, and we'll dive deeper on why this is, as well as expand on other cholesterol and lipid markers in future videos. When testing for cholesterol in relation to brain and cardiovascular health, we must always also test for insulin resistance markers. Check out episode 14 for these. Dr. Bredesen has found that insulin resistance is the single most important metabolic contributor to Alzheimer's disease development and progression, and that the biggest drivers of insulin resistance for us are diets high in simple carbohydrates such as sugar, processed food full of high fructose corn syrup, sedentary lifestyles, poor sleep, and chronic stress from work and home lives. But he also found that the antidote to reversing insulin resistance and restoring insulin sensitivity was optimizing the right diet, exercise, sleep, and stress management programs within patients' protocols. These are the core pillars of the RECODE protocol. And the biggest lever in achieving this level of insulin sensitivity is what we eat every day. To learn more about this, please check out episode 16, linked on the screen and in the description box below, for a brief overview of Dr. Bredesen's anti-Alzheimer's diet. I've also linked all of Dr. Bredesen's recent studies. If you're asking, how do I get tested for these labs to assess my Alzheimer's risk? Check out Dr. Bredesen's website and episode 12, both linked in the description box below for more information. And I'd love to hear from you. Has your neurologist ever spoken to you about total cholesterol levels? What do you think of this video? Please drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve, and please like and subscribe as it helps our community grow. And remember, I'm not a doctor, I don't have a PhD, I'm a caregiver and citizen researcher on the ground helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. I hope these resources are helpful to you and your family. And see you in the next video. Thanks.